awakened by a partial dislocation of my knee, aka a subluxation. That's actually a pretty normal part of having Ehlers Danlos Syndrome. My name is Roseanne, and I do have Ehlers Danlos Syndrome. And today I'm kind of sharing I definitely am sharing my experiences with dislocations waking me up. It's just been a thing for quite a while, for most of my life actually, but it's really gotten quite painful within the last decade. So first up, this video is for entertainment and educational purposes only. This is not medical advice. I am vlogging. I am sharing my personal experiences with waking up to dislocated or partially dislocated joints. Go to your doctor for medical treatment. All right, disclaimer out of the way. So this morning I woke up with a partial dislocation in my left knee, which is actually my good knee. And it just kind of sets the pace for my day, right? You know, you wake up to something like that. It's not pleasant. As the day goes on, I'm kind of starting to feel the pain throughout more places in my leg and hip, because that's just it's a traumatic injury. That's the thing with Ehlers Danlos Syndrome. It's battling a prolonged chronic illness and acute injuries at the same time. And it's a lot of juggling. So I could do all the things that I am supposed to do, like staying as active as I can without hurting myself. You know, I've been through a lot of physical therapy, and I'm very grateful for the physical therapists that I've had throughout the years who've taught me to kind of maintain and hold on to as much mobility in my knees as possible and the rest of my joints. That's kind of the weird thing. You have too much mobility, everything's falling out of place, especially, you know, when you're younger. At least that was my experience with Ehlers Danlos. But as you get older, as I got older, stuff just went from moving too much to, like, sometimes I can't get it to really move at all. So, you know, it's always an interesting thing there. I have woken up to my actual bad knee fully dislocated many times, grinding across, you know, the cartilage and stuff and putting it back into place. Now it's just like, oh, I get up and deal with it, brace it, and try to, you know, keep it as comfortable as possible, as protected as I can while I sleep. But I think, you know, my left leg is now compensating for having that weakness in my right and that chronic injuries. I've never had either of my knees MRI'd, although it's been brought up. I mean, these issues have been bad for over a decade now, going on two. I think I got cortisone shots in my knees in 2014, and that was when I had, you know, the year I had officially been diagnosed with Ehlers Danlos Syndrome, and I didn't know that I needed to avoid the cortisone shots yet, but I had put it together and found out pretty quick that, yeah, I needed to avoid that. I had several throughout my body, and they didn't really help. They kind of aggravated me, and then I got the wonderful just lectures from the doctors that I didn't know what was good for me, you know, and what I felt and what was happening. But they did. They knew that I should be fine from this. And then later on, after my diagnosis and reading all the information that goes with Ehlers Danlos and cortisone shots and the risks there, you know, it was, yeah, it was nice to get validated, but I don't want to be validated in that way. I would like to have just avoided that possible problem inducing medication to begin with. But you live and you learn. So, how do I handle dislocations now? You know, I've been dealing with these problems my entire life, and it just is, progressively getting worse as illness does, especially things without any cure. And then you have the aging aspect of it as well. So today I'm going to try and keep myself as comfortable as possible. I'm going to ice my knee and heat it, and I might put it in a brace or a support. I'll probably get my cane out at some point because the other knee is pretty bad off. Like I've said, I've been through physical therapy a few times, but it often causes me to flare up and I stop going and I never get my MRI because you have to like suffer and totally destroy what's left of your functioning joint before insurance will cover an MRI. So I guess 2 decades, nearly 2 decades worth of knee torment isn't worth, it's worth me suffering it, spending the $2,000 or whatever it is for an MRI. No. Suffering for 20 years, okay, it's like, well, wow, if companies were doing that to pet cats and dogs, just imagine the outrage. I know most people aren't as wonderful as a cat or a dog, but I mean, come on. Maybe if we started treating human beings like human beings, society would be a more pleasant place. So now that I'm done ranting, yes, what I plan to do is get as comfortable as possible, bracing, icing, heat, using my cane when needed, but mostly I just want to kind of take care of it, do the whole rice thing. I'll put rice up here, what that means. Again, not medical advice, just sharing my personal experiences in this vlog. And after the joint has rested for a few days and it starts to let up and feel better, I do all the stuff that my doctor and physical therapists have recommended over the years, regimen. So yeah, that's my personal experiences waking up to dislocated joints. Today it was the knee. A few weeks ago it was the right shoulder. That's been a couple times this summer I've had that problem. So I finally found a brace for that works. But okay, that's it. That's it for now. Thank you so much for watching. I hope you have a good day, and please do subscribe, and if you enjoyed the video, give it a like.